All right, I'm Dr. Chad Spillers from Aspenridge Chiropractic Center. We provide chiropractic care, acupuncture, customized orthotics, and physical rehab. Today we're going to talk about some lumbar spine issues, but before we even do that, I just want to talk a little bit about the spine in general. The spine, there's 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and then you have the sacrum and the pelvic bones here, which are called ilii. The shape of the spine is an S shape. The reason for that is that it acts kind of like a spring, okay? And the alignment of these vertebrae are very important. So let's go to the next one here. So low back pain, some of the factors that can contribute, you can read along here. Degeneration is, everybody degenerates as we age. That's the osteoarthritis or the degenerative arthritis that you hear about. Poor posture, heavy lifting, repetitive motions, obesity, genetics, trauma, injury, smoking, sedentary lifestyle. That's huge because we just sit in rooms all day and stare at screens. And then medical conditions, you can have infections and those kind of things. So the areas that can be troublesome are the vertebrae themselves. Here I talked a little bit earlier about chiropractic subluxations, and you can see this vertebra is kind of tipped to the side. That can cause pain in and of itself, but if it's left untreated, it can expedite the degenerative change later on. You can have pain at the sacroiliac joint between the sacrum and the ilii. And then you can have disc bulges. So let's move on to the next one. Types of back pain: achy, deep, dull, burning, numbness, stabbing, tingling, cramping, stiffness, and decreased range of motion. I want to talk a little bit about the difference between disc, like a blown disc. There's a misnomer out there. People say, well, that I've been told I've got a slip disc. Discs do not slip. They can herniate, they can bulge, but they're not sliding around in there. They're just, they're pretty much fixated. So disc type pain, very classic, is the sciatic nerve. It consists of a bunch of different nerve roots from L4, L5, S1, S2, and S3. That's the sacral area where the nerves exit the spine. A classic picture of that is pain radiating all the way down the leg and into the foot, okay? That versus, and that's a very general term, it can do a lot of other things as well. The sacroiliac type symptoms, there's 3 generally that I see quite often. There's pain that radiates down the leg, but usually not below the knee, sometimes into the upper calf. There's pain that can radiate around the front of the leg, and usually that's superficial, or there's pain that wraps around into the groin. And so I always ask people, does the radiating pain go past the knee? Because that's kind of an indicator that it's more of a disc type problem. So let's move to the next. So here's some degenerative change in the lumbar spine. You've got a normal spine here, you've got the vertebral body and the disc, and back here where the nerves exit, the spinal nerves exit, you can be fortunate and have big openings, or you can be genetically compromised and have small openings, so that when these vertebrae start to degenerate, and you can see some spurring here, and as we go down the line here, it increases. The disc spaces get smaller, so the discs, they kind of, for lack of a better term, dry up and they shrink. So the importance of that is that the discs are designed to carry most of the load. These joints back here, which are called facet joints, are designed to direct motion, forward, backward, rotation, and lateral flexion. When the discs become smaller, some of the load is carried back here, and what happens is there's a law called Wolff's Law, that states that when there's pressure put on bone, more bone will be laid down. So you get the degenerative changes back here, and if it gets bad enough, the vertebrae themselves will try to fuse the joint. Not a good thing. This is a bad day right here. Okay, this could be a bad day too. So move on. Again, you've got the spinal cord here that runs all the way down the spine at about L1 or L2 in the lumbar spine. It breaks up into what's called the cauda equina, where it kind of branches off into individual nerves. Equina means horse, so it looks like a horse tail. You've got here the inside of the disc is called the nucleus pulposus. Big fancy words. Basically, that's kind of like a crab meat gel consistency. Around the outside of the disc, you've got what's called the annulus fibrosus, which is very tough. It's like a steel-belted radial tire. And then you have that facet joint that I was talking about in the back that helps direct motion with the, all motions in all planes. The spinous process that sticks out the back here, muscles attached to that, that's how you move. And as well as the transverse process. They're just little lever arms where muscles attach. Then you have the spinal nerve here. The nerves exit the foramen here, just a hole, and go down and innervate everything in the body. Every nerve and every cell in the body is either directly innervated by these or indirectly innervated by these through, so say you have a gland, the nerves go to the gland, tells the gland to produce something, then the gland releases that, and then that affects the body. So it's still part of the nervous system. Everything's affected by the nervous system, okay? So oftentimes we see disc bulging. There's a lot of people walking around. If you do 100 MRIs, you're gonna have a bunch of them that have bulging discs, and the people never even know they have them. You can have the inside kind of bulging out into the fibrous outer part. As you get further down, you can have a disc protrusion, and with that, I don't know if you can see this, but when it'll push on the nerves, it'll either push on the spinal nerves here, or it can push on the cord itself. If it pushes on the cord, that's a real bad day. And there's a condition called cauda equina syndrome, where if you have it, you don't come see me, you go to the ER, and not now, you go right now. When it pushes on the cauda equina, you can be paralyzed in several hours. So you got to get in and get that decompressed immediately. But so with the you have extrusion. This is an example of an extruded disc where it's pushing out. You can also have what's called sequestration, where this thing breaks off and then it's floating around in here, and that's really bad as well. So move on there. So the degenerative changes, we talked about Wolff's Law a little bit, and so these joints back here become enlarged, and the vertebral body itself tries to fuse with the one above it and below it. So when that happens, just like a surgical fusion, if you have a surgical fusion, if these two are fused, that means the one above it and below it have to work harder and do more work than they were designed to do. Bone spurs, these are what are considered bone spurs. They're not as big a deal out here, but if they're in this area, they can impinge on these nerves and cause all kinds of grief. Okay, we can move on. So here's one of the quotes of the day, okay? This is very important. A body in motion tends to stay in motion. A body at rest tends to rest in peace. We have to get up. We have to move around. If you have standing desks, use them. Break it up. If you're stuck at a desk all day, get up, move around. You got to get these things moving, or you will be seeing me. So let's move on to the next. Doctor of the future will give no medicine, but will instruct his patients in the care of the human frame, in diet, and the cause and prevention of disease. That's Thomas Edison. That's that's a long time ago, and he was fairly smart. I don't know if you guys have picked up on that. So what do we have next? Okay, so, and then we can shut that off if we can. Thank you very much. The